Thank you, Mr. Chairman, and thank you to Ranking Member Clark for holding this hearing today. Thank you to our witnesses for your testimony, for being here. As several of my colleagues have mentioned already, many of us are fearful because the actions that we've seen from President Trump and this administration make us less prepared in the event of a pandemic and a public health crisis, as we've discussed today. This year, Secretary Kennedy, as everyone here knows, has fired thousands of scientists and civil servants who work to keep us safe from disease, who protect us from harmful products, and who carry out critical research to advance new cures. He has sown distrust in dedicated scientists and public servants and replaced them with quacks who deny the efficacy of modern medicine and vaccines. And he has systematically destroyed the pipeline for biomedical research, including emergency response measures to protect us from the next pandemic. Since January, the Trump administration has terminated at least 1,229 NIH research grants totaling nearly $500 million. A few examples of those terminated projects include a project that would enhance vaccine delivery in hospitalized children, a project studying proteins that could promote resilience to Alzheimer's, projects bringing us closer to vaccines for diseases without cures like HIV. And in my home in Houston, where we have the largest medical complex in the world and where researchers are conducting this cutting-edge medical research, they are saving lives. Research done in Houston saved lives during the COVID-19 pandemic. Research being done right now in Houston will save lives during the next pandemic. And the Trump administration's policies and actions are putting that work at risk. So, Dr. Havers, I want to ask you, how has Secretary Kennedy's reckless termination of NIH grants affected our preparedness posture?
Well, I think what we've seen from this administration is, as has been mentioned, massive funding cuts, pulling back from grants, but also an introduction of ideology into who is getting grants. As I mentioned, the mRNA vaccine research that was being yanked, that was not based on science. I do think that it has a chilling effect on science, the scientific community in the United States overall. I think that the pipeline of new research and is being cut off, including young researchers entering their careers. We are not going to get talent from abroad coming to the United States to improve scientific innovation. And I think that industry is going to flee the United States because it is no longer a stable place where innovative scientific research is supported. So I think that this is going to have long-lasting cuts, and we will end up with fewer tools to combat emerging threats going forward.
Thank you, Dr. Havers. In March of 2020, Dr. Peter Hotez, who is one of my constituents and is the co-director of the Texas Children's Hospital Center for Vaccine Development, told the House Committee on Science, Space, and Technology that I served on at the time that we will be fighting the COVID-19 pandemic with one hand tied behind our backs at that time because we failed to invest time and resources into vaccine research. And at great cost, we pulled through the pandemic, as we've talked about earlier today. But we are once again tying our hands behind our backs as the Trump administration makes devastating cuts to NIH research grant funding that will jeopardize so much of this work that we've been doing. And Dr. Diggins, your company sounded the alarm on federal research disruption in a filing with the SEC on November 17th, 2025. The company stated, and I'm quoting, that the administration's halt on certain federal research grants may negatively impact our industry, and, end quote, and that the, quote, prolonged reductions in such funding could slow innovation. Dr. Diggins, could you expand on this and explain how disruptions to federal research funding could slow innovation?
So as a member of the biotech supply chain, we're proud to support the research that's going on, supported by many of these grants. And so the reduction in that overall spending certainly impacts the biotech supply chain in ways that can hold back technology development or productization.
Thank you, Dr. Diggins. I think that for all of us, the pauses in funding for grants and at institutions that do critical medical research is really undoing decades of work. And this country has invested in that research and invested in this system to lead the world. And so we really need to reassert our our jurisdiction here. I do believe we need to bring Secretary Kennedy in before the committee, and we need to make sure that we're protecting our medical research and our scientific research more broadly. So thank you all for your testimony and for sharing your observations and your perspectives with us. And Mr. Chairman, I will yield back.